I'm Dr. Alberto Michel Macareno. I'm a bariatric surgeon. I have been a surgeon since 2010, so almost 3 years since I do my degree in general surgeon and also do my degree in bariatric surgery. Why I decided to study medicine? Well, because I like to help people. That's my first thought, to help people. The other thing is my father is a medic, also a surgeon, so I really love to work with him. So that's my second reason that I decided to study medicine. I do a sleeve gastrectomy, I do gastriplication, I do mini bypass, and also bypass.
Okay. And what was it that made you decide to get in that type of
Sure.
of medical?
Well, since I started my degree in general surgeon, I have one of my doctors, my teachers, he really liked to help people with weight loss surgery. So when I started to do my degree in general surgeon, I really enjoyed to work with patients having this kind of problem. So that's the reason that I decided to do this kind of surgeries, weight loss surgeries. When people have comorbidities like diabetes or hypertension, and there are also people young, they don't have comorbidities at this moment, they should take this decision to do weight loss surgery, because if you have problems with your weight, you're going to have in the future a lot of problems like diabetes, hypertension. So this kind of problems, these comorbidities, reduce the lifestyle of the people. So is basic for all the people who have overweight to do or take this decision when you have maybe, or you're going to have maybe in the future comorbidities. And also when people that are doing diets during the years with no results, this is a very good options and very good result. Well, first of all, it depends on the BMI of the patient. So if the patient has 35 and over 35 and they have comorbidities, that patient is a good client or has an option to do a weight loss surgery. This is the first thing that we look for the patient, to know what's the BMI of the patient. Or also if they have comorbidities. We do bypass and mini bypass. In this kind of surgery we call it metabolic surgery, because we have almost a cure of the diabetes and with very good results. All the patients have or they are having a lot of problems having their controlled blood or glucose with no results, taking a lot of medications. This kind of surgery has very good results. So the things that are very important is BMI and also the comorbidities of the patient.
Okay.
In our team, in our team, we recommend to the patient, we have a diet. We have a pre-diet or pre-operation diet, consists in 7 days. It's a diet has lower concentration of proteins, so the patient drink a lot of water, yogurt. That's basic for us, so we can reduce the size of the liver. So that's a very good option during the surgery and post the surgery, because sometimes when the patient do this kind of diets, they lose like 10, 12 pounds before the surgery. So that's very good for us. So that's one of the first things that we recommend to the patient: diet pre-operation, and also we have a diet post-operation. So the diet post-operation consists in one month doing basic. The first month is the patient have to drink a lot of liquids. That's basic, Jello, juice, water, and during the second or the third week, we introduce a different kind of alimentation for the patient. So we can have very good results during the first month, losing around 35, maybe 30 pounds, depending on the patients. The first 3 months are the most important weight loss for the patient. So then when we complete the year, we usually weigh the person. They normally lose around 80 to 90% of the weight loss of the excessive weight. So it depends of the surgery. But the three first months are the most important during the process. How long? Depends. Again, depends on the patient. Usually the patients lose 35, 40, 60 pounds the first 3 months, then they continue. But it's very important to us to check the patient each month. Maybe not seeing the patient, but just talking with the patient, ask him how do you feel, maybe get a recommendation for the patient to continue this losing weight during the first year. Basically, why I recommend our team is because for our team is priority the security of the patient. It's very important for us. I don't try to do the surgery the fastest I can. I do it the best way I can. So if we stay only 1 hour, that's okay. We stay 2 hours, that's okay. The important thing is that patient has a good results. Not results in 1 year, results in the first moment when the patient goes out of the operating room, and then when the patient goes to his home, and then when he's come back and has a very good weight loss. I'm only one part of the team. So our team consists in medicine intern doctors. We also have general doctors. We have my father also is a general surgeon. He always helped me with the surgery. He has almost 25 years of surgeon, so we have a lot of experience in our team. We also have a very good hospital. I think that we have one of the best hospitals in Tijuana. It's beautiful. We have all the accommodations that we recommend for any patient. And I just want to say that we are one of the best team right here, not also in Tijuana, but in Mexico. I want to talk about a good experience during my work with weight loss surgeries. I know a lot of people. I have been working with a lot of patients right now with very good results. But for me, it's very important to the patient to have the good results, because when a patient comes to our office and talk about his own life, his problems during all his life, having problems like divorce, having problems with his own kids, taking to his mother that she don't want to. His mother comes to our school to pick it up because she has weight problems. So that's the main problem of our surgery, to have good results for the patients. He's gonna reduce his comorbidities, but also his style of life is gonna change drastically. I have been working with a lot of patients having problems with his weight problems, with his comorbidities, but it's not only the problem with the patient, the comorbidities. Is the lifestyle of the patients. Almost all the patients who has these kind of problems with his weight, they have problems like depression. Not everybody think about these problems or say they have these kind of problems. But when you sit with the patient and you talk with the patient, you treat the patient like part of your family. They always open his heart and tell you about his real problems. And the real problems, they have a lot of patients with these kind of problems with his weight. there are a lot of problems with his family, with his friends, with his job. A lot of people having problems because they're making bullying. There are a lot of problems. So when you change this kind of problem, when you change the weight of the patient, when you do something to help this kind of problems, or do you try to help this patient with what in our team, with our surgery, they come 3 months, 4 months, 6 months, and they are happy. They are happier. They look happy. They want to hug you. They want to say, "Hey, you almost saved my life. You saved my life. I'm glad that I met you. I met your team. I met your group," and that's a real success for us. That's we have a lot of cases of with good exit. We have a lot of patients with success during this year. So like a patient, if you have weight loss, you're having problems with your weight, we recommend you to come with us. We're gonna help you. You're gonna be not part of our team, but yes, part of like our group, our family. We're gonna treat you like a part of our family. So we know what kind of problems you're having. We know that you're having a lot of problems. So we want to help you. We have a lot of surgeries or kind of surgeries that can help you and change your life.